Okay, so you want to be ready for a choking emergency.
Yeah.
It's one of those things you never want to think about,
Right.
but knowing what to do could seriously save someone's life.
You got it.
We're going to take a deep dive into the world of choking,
Okay.
how to recognize it,
Uh,
and more importantly, how to respond effectively.
Absolutely. And we're not just talking about the Heimlich maneuver here. We'll cover the signs
Okay.
and symptoms in both adults and children,
Okay.
but also delves into the physiology of choking
Interesting.
and what actually happens in the airway.
Yeah.
And of course, we'll break down those life-saving steps you can take in an emergency.
I think what I'm most curious about is how to tell if someone's truly choking,
Okay.
not just coughing or struggling with a bit of food.
That's a crucial distinction. And sometimes it can be subtle, especially in the early stages. Let's start with adults. The classic sign, of course, is the inability to speak.
Yeah.
If someone suddenly goes silent, especially while eating, that's a huge red flag.
Right.
They might also be clutching their throat,
Oh, yeah.
the universal choking sign, or making weak coughing sounds.
Okay, so no speaking, clutching the throat, weak coughs. What else should we be looking for?
Well, pay attention to their breathing.
Okay.
Are they struggling to get air in?
Oh.
Is their breathing noisy or high-pitched?
Mm-mm.
And keep an eye on their skin color.
Yeah.
A bluish tinge, especially around the lips and fingertips, indicates a severe lack of oxygen. That's a sign of a complete airway obstruction.
Okay. That sounds terrifying. It must be even harder to spot the signs in children, right? They can't always tell us what's wrong.
Exactly. With young kids, you have to be extra vigilant.
Okay.
Sudden coughing or gagging, especially during meals or playtime, is a warning sign.
Ah.
Listen for any unusual sounds during breathing, a whistling sound,
Okay.
or stridor, as it's medically known, could mean the airway is partially blocked.
So we're listening for any change in their breathing? Any unusual sounds? What other behavior?
Yeah.
Are there any behavioral cues that might indicate choking?
Absolutely.
Okay.
If a child suddenly goes silent, unable to cry,
No.
or even babble,
Yeah?
that's a major red flag.
Right.
It means they can't get enough air to make any sound.
Scary.
Also, look for excessive drooling.
Oh, okay.
It might seem like a minor thing, but if a child is suddenly drooling more than usual,
Uh-huh.
it could indicate difficulty swallowing, which might be related to a choking hazard.
Wow. So many things to watch out for.
Right.
It really highlights how important it is to be aware and observant,
Yes.
especially around young children.
We got it. And this awareness isn't just about recognizing the signs,
Okay.
but also understanding the physiology of choking.
Mm.
Do you know what actually happens in the airway when someone chokes?
I have a general idea, but I'd love to hear you explain it.
Sure. Imagine the airway as a tube with a little flap called the epiglottis at the top.
Uh-huh.
Usually when you swallow, this flap closes over the trachea or windpipe, directing food down the esophagus and into the stomach.
Right.
But when someone chokes, this process malfunctions. The food or object gets lodged in the airway, blocking the flow of air.
So the epiglottis doesn't do its job and the airway gets blocked. That makes perfect sense.
Right.
But how do we know how serious the situation is? Is it totally blocked or can some air still get through?
That's where the difference between a partial and complete obstruction comes in. If the person can still cough forcefully, speak, or breathe, even with difficulty, it's likely a partial obstruction. Their body is still trying to expel the object, and we can actually encourage that natural response.
So if someone's coughing forcefully,
Yeah,
we don't necessarily need to jump in with the Heimlich maneuver right away.
exactly. In a partial obstruction, coughing is actually the best defense. Encourage them to keep coughing. It's their body's way of trying to dislodge the object.
Okay.
But if coughing is weak, or they can't make any sound at all, that's when we need to take more drastic action.
Okay, so that's when we know it's a complete obstruction and things are getting really serious. Now, before we move on to what to do in those situations,
Right.
is there anything else we need to know about recognizing choking? Any lesser-known signs or risk factors we should be aware of? You know, when we think about choking hazards, we usually picture food.
Right.
But what about other things? I remember reading that balloons can be a surprisingly common cause of choking,
Well, yeah.
especially in young children.
That's a great point.
Yeah.
Balloons are definitely a hidden danger.
Uh-huh.
Kids can easily inhale a deflated balloon
Oh, wow.
or pieces of a burst one.
Right.
And those pieces can be very difficult to dislodge.
Yeah.
So yeah, maybe skip the balloons for the under 5 set.
Good advice. And it makes you realize that choking hazards can be lurking everywhere, not just in the kitchen. What are some other unexpected choking risks we should be aware of?
Well, think about everyday objects that might not seem dangerous at first glance.
Okay.
Coins, marbles, small toy parts.
Hmm.
Anything small enough to fit through a toilet paper roll
Ah, okay.
can be a potential choking hazard.
Yeah.
And it's not just about kids putting things in their mouths.
Right.
Adults can choke on things too,
Oh, of course.
especially if they're talking or laughing while eating,
Mm-hmm.
or if they have dentures that aren't fitting properly.
Oh, that's interesting. It's like we need to develop a sixth sense for spotting potential choking hazards.
Right.
So we've talked about recognizing the signs of choking
Huh.
and understanding how serious the situation is. Now let's get to the part everyone wants to know.
Yeah.
What do we actually do if someone's choking?
All right, let's dive into action mode.
Mm-hmm.
First things first, if you suspect someone is choking, confirm it.
Okay.
Ask them directly,
Okay.
are you choking?
Yeah.
If they can't speak or respond verbally,
Right.
that's your cue to assume a complete obstruction and act immediately.
Okay, so we've confirmed they're choking. What's the next step? Everyone's heard of the Heimlich maneuver, but is it always the right approach?
The Heimlich maneuver is definitely the go-to technique for choking emergencies in adults and older children.
Okay.
It's a series of abdominal thrusts that help expel the object blocking the airway.
Mm-hmm.
But before you jump into action, there are a few things to consider.
Like what?
First, assess the situation.
Okay.
If the person is coughing forcefully,
Uh-huh.
let them continue coughing.
Mm.
That's their body's natural defense mechanism working.
Right.
Only intervene if the coughing becomes weak or ineffective.
So we don't want to interrupt a strong cough. Got it. But what if it's clear they can't breathe and the Heimlich is necessary? How do we do it correctly?
All right, here's the breakdown.
Okay.
Stand behind the person and wrap your arms around their waist.
Mm-hmm.
Make a fist with one hand and place it just above their navel,
Okay.
with your thumb facing inward. Then grasp your fist with your other hand
Uh-huh.
and give quick upward thrusts, as if you're trying to lift them up.
I've always wondered about the force needed for those thrusts. Is it a gentle push, or do you really need to put our back into it?
It's definitely more than a gentle push,
Yeah.
but you also don't want to be overly forceful.
Okay.
The key is to use enough force to create pressure in the abdomen, which will hopefully dislodge the object.
Ah.
Think of it like you're trying to squeeze the air out of them.
Okay, squeeze the air out. I like that analogy. And we keep doing these thrusts until...
Until the object is expelled.
Okay.
Or until they become unresponsive.
Right.
If they lose consciousness, we need to shift gears and start CPR immediately.
CPR. That's another one of those things I know I should know how to do, but I'm not sure I could actually perform it in an emergency.
Mm-hmm.
Can you remind us about the basics?
Absolutely. CPR stands for cardiopulmonary resuscitation.
Okay.
It's a life-saving technique that combines chest compressions and rescue breaths to keep blood and oxygen flowing through the body when the heart has stopped beating.
So in a choking situation, if the person becomes unresponsive, CPR is crucial because their heart might have stopped due to lack of oxygen.
Exactly.
Yeah.
The Heimlich is all about dislodging the object, but CPR is about keeping them alive until medical professionals arrive.
Right.
And it's not as complicated as you might think.
Okay.
The American Heart Association has simplified the steps for laypersons.
Mm-hmm.
Basically, you start with chest compressions.
Okay.
Push hard and fast in the center of the chest at a rate of about 100 to 120 compressions per minute.
And what about rescue breaths?
Uh-huh.
I remember something about pinching the nose and breathing into their mouth.
Yes, that's part of it.
Okay.
After 30 chest compressions, you give 2 rescue breaths.
Okay.
Tilt the person's head back gently, lift their chin, pinch their nose shut, and seal your mouth over theirs.
Mm-hmm.
Then give 2 breaths, each lasting about 1 second. And you keep alternating between compressions and breaths until help arrives or the person starts breathing again on their own.
Okay, that's a lot to remember.
Yeah.
But I'm starting to see how those basic steps could really make a difference in a life or death situation. Now, we've focused on adults so far.
Uh-huh.
Is the approach for children the same?
For older children, yes. The Heimlich maneuver and CPR techniques are essentially the same.
Okay.
But for infants under 1 year old,
Okay.
we need to modify the approach.
Okay. Babies are a whole different ball game.
Right.
What changes do we need to make for them?
For infants, we use a combination of back blows and chest thrusts.
Okay.
Imagine holding the baby face down on your forearm,
Mm-hmm.
supporting their chin and jaw with your hand.
Okay.
Then, Give 5 firm back blows between the shoulder blades.
Back blows, I've heard of that.
Yeah,
But isn't there a risk of injuring the baby with those blows?
that's a common concern, but when done correctly, back blows are safe and effective.
Okay.
The key is to use a firm but controlled motion,
Hmm.
aiming for the area between the shoulder blades.
Right.
You're not trying to hit them hard, but rather create a vibration that will hopefully dislodge the object.
Right.
Think of it like a gentle but firm pat.
Gentle but firm, got it. Yeah.
And what about chest thrusts? Where do those come in?
After the back blows, you flip the baby over,
Okay.
supporting their head and neck. Then, using 2 fingers, you give 5 chest thrusts on the breastbone, just below the nipple line.
Uh-huh.
It's similar to the chest compressions in CPR, but with less force and using only 2 fingers.
So 5 back blows, 5 chest thrusts.
Right.
We keep alternating between those until the object comes out.
Yes,
And if the baby becomes unresponsive, we switch to infant CPR.
exactly. And infant CPR is very similar to adult CPR, but with a few key differences. You use 2 fingers instead of your whole hand for chest compressions, and you deliver breaths more gently.
Mm-hmm.
And just like with adults, you continue CPR until help arrives or the baby starts breathing again on their own.
It's incredible how even these small changes in technique can make a huge difference in the effectiveness of these life-saving measures. Talking about all this is a bit overwhelming.
Yeah.
But it's also incredibly empowering.
It feels like we're equipping ourselves with the tools to handle a truly terrifying situation.
I couldn't agree more. Knowledge is power, especially when it comes to emergency situations.
Right.
And while we all hope we never have to use these techniques,
Yeah,
being prepared can literally mean the difference between life and death.
that's a good point.
Now, before we wrap up this deep dive, there's one more crucial aspect we need to talk about. Prevention.
Okay.
Because, as you know, the best way to handle a choking emergency is to avoid it altogether. You're absolutely right. It's like that old saying,
Yeah.
an ounce of prevention is worth a pound of cure.
Right.
So let's shift gears and talk about how we can prevent these situations from happening in the first place.
Okay.
It all starts with being aware of the most common choking hazards.
Okay, so let's talk about choking hazards. Where do we even begin? It feels like there's potential danger lurking everywhere.
It can seem that way,
Right.
but with a bit of knowledge and awareness, we can significantly reduce the risks.
Okay.
Let's start with food, as it's a major culprit, especially for young children.
Okay.
Think about those classic choking culprits.
Uh-huh.
Hot dogs, grapes, hard candies. These foods are often the perfect size and shape to get lodged in a child's airway.
I remember seeing a statistic somewhere that hot dogs are responsible for a significant number of choking incidents in kids. I guess their shape makes them particularly dangerous.
You're right, they are.
Yeah.
Cutting those foods into smaller pieces
Okay.
or avoiding them altogether for toddlers and young children can make a huge difference.
Right.
And it's not just about the type of food,
Okay.
but also how it's prepared.
Huh.
Make sure food is cut into bite-sized pieces,
Okay.
cooked thoroughly to soften it up,
Uh-huh.
and served in a way that minimizes the risk of choking.
So think finger foods instead of large chunks.
Yeah.
And what about the eating environment itself?
Right.
Does that play a role in choking prevention?
Absolutely. Creating a safe and distraction-free eating environment is key. Encourage kids to sit down while eating,
Okay.
avoid letting them run around with food in their mouths,
Right.
and discourage talking or laughing while chewing. These might seem like small things,
Yeah.
but they can significantly reduce the risk of choking.
Makes sense. It's about creating a mindful eating experience, both for kids and adults. And speaking of adults, we often forget that they can choke too, right?
That's right. We tend to focus on children, but adults are certainly not immune to choking. Things like talking or laughing while eating,
Yeah.
eating too quickly,
Yeah.
or not chewing food properly can all increase the risk.
So it's back to that mindful eating again, taking smaller bites, chewing thoroughly, and avoiding distractions. And what about dentures? I imagine that could be a factor for older adults.
Dentures can definitely increase the risk of choking, especially if they don't fit properly. It's important for older adults to have their dentures checked regularly and to avoid foods that are hard, sticky, or difficult to chew with dentures.
Okay, so we've covered food hazards.
Yeah.
What about those non-food items that can pose a choking risk?
Well, as we mentioned earlier, balloons are a big one, especially for young children. But there are so many other everyday objects that we need to be mindful of.
Right.
Coins, marbles, buttons, small toy parts. Anything small enough to fit through that toilet paper roll test can be a potential choking hazard.
The toilet paper roll test, that's a great visual reminder.
Right.
It's amazing how we can find choking hazards in almost every room of the house.
Exactly. And it's not just about keeping these items out of reach.
Okay.
It's also about being aware of our surroundings.
Uh-huh.
Think about places where small objects might collect.
Okay.
Under furniture, in corners, in toy bins.
Yeah.
Regularly checking these areas
Uh-huh.
and picking up any potential choking hazards can make a big difference.
It's like we need to develop a new habit of scanning our environment for those hidden dangers, almost like a choking hazard detector.
I love that analogy.
Yeah.
And, it's not just about our homes.
Right.
Public places can be full of potential choking hazards, too.
Oh, of course.
Parks, playgrounds, restaurants. These are all places where we need to be extra vigilant, especially with young children.
So whether we're at home or out and about, it's about being aware and proactive.
Yeah.
Okay. This deep dive has been intense, but I feel so much more prepared now. It's amazing how a bit of knowledge and awareness can empower us to handle even the most frightening situations.
I completely agree. And remember, this information is not just for you. Share it with your friends, your family, your babysitters, anyone who cares for children. The more people who know how to recognize and respond to a choking emergency, the safer our community becomes.
Well said. To our listeners, thank you for joining us on this deep dive. We hope you never have to use this information, but if you do, remember the key takeaways. Stay calm, act quickly, and trust your instincts. And most importantly, don't be afraid to ask for help. You have the power to make a difference. Stay safe out there.
You've been listening to the Learning Podcast, a production of Metanesta. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.